Today, I'm delighted to have as one of our guests in the Living Legend series is Dr. Paul Perito. Dr. Perito enjoys many accolades and accomplishments. He is considered by urologists in the United States and throughout the world as the Prince of Prosthetics. He performs over 500 penile prosthesis operations a year and has implanted over 8,000 men, making him the leading implanter in the world. Dr. Perito is recognized for his minimally invasive technique for the implantation of the inflatable penile prosthesis. I once heard that he could do an implant in less than 20 minutes. I didn't believe it until I went to Miami and got permission to be his assistant, and he did a procedure in 12 minutes. He has trained hundreds of urologists worldwide on his minimally invasive technique. If the Guinness Book of Records were to list the world's leading implanters, Dr. Paul Perito would be numero uno. Welcome, Paul, to Grand Rounds in Urology.
Thank you very much, and those were very kind words. I'm sure
Well, I
there's
meant
another paragraph after.
more to come.
More to
All
come.
right, let's start, Paul. Let me ask you, how did you get involved in prosthetics?
You know, I don't know if you remember, but you were an integral part of that. I was doing my residency in general surgery and urology at the University of Miami. You came as a lecturer in men's health talking about erectile dysfunction because Dr. Carrion Sr. was there as well as Dr. Politano. And your lecture got me kind of hot on the topic of men's health, and you talked about how it's a discipline that's fun, and it's a discipline where you can really reach out, and it's not everything cancer is. It's quite the opposite. So between you and Carrion Senior, that's where I was introduced to prosthetics. And then when I came back, I did a fellowship in Australia, nothing to do with prosthetics. And I was working out of the office of a guy that was doing, at the time, quite a few implants. And then I found something I liked, and then I just sort of shipped things to my taste when it came to an office, and hung a shingle in a day. And I gave a talk, day sex on South Beach, and I had 500 patients in a day. That's how I got into prosthetics and men's health. And you were a part of it, Dr. Baum, for
Yeah,
sure.
that's nice to feel part of your success. Now let me ask you this. You have streamlined the operation that for even most implanters, do 45 minutes to an hour. And you're not a speed freak. You are careful and yet you're able to streamline that procedure that anyone who comes and learns the technique can do it in 20 minutes. I saw it myself, and I was one of your pupils. So share with us, how did you streamline from, let's just say, a good implanter, 10 years ago was 45 minutes to an hour. Today, 20 minutes.
So when you look at any technique, you have to like cut out the fluff. And there was so much fluff, all for the right reasons. The fluff was, to prevent infection, where you would irrigate out the urethra and all these little extra steps. And I believe I counted some of the initial descriptions of penoscrotal procedures as having 40 to 50 steps. And I was able to take the 40 to 50 steps, move infrapubically for reasons that are different than the actual algorithm of the case, but it moved it to 13 steps. And believe it or not, just now there's a multi-institutional study saying that, hey, why are we serially dilating? When we published this back in 2006, 2005, the actual 12-step, 13-step procedure. So you constantly have to whittle out stuff that's unnecessary whenever you're forging ahead with, with a procedure. Not that we're speed freaks. I mean, that is something that
I didn't imply that.
yeah. Um, but we just cut out a bunch of fluff. The biggest one is all the serial dilation, because you, as a teaching professor, every time you put a dilator in a resident's hands, certain areas start to sweat, and I don't blame it, because we trained like 600 people. When we used to train that was not the right way. So whatever you're doing, if you're doing an appendix laparoscopically, there's steps that can be removed that are not necessary.
Tell us, I know I was one of your 500 pupils. Tell us about your training program, the assistance of the industry, and how that got started, and what direction do you plan to take that?
I hope that one of my good friends who's actually retiring from the industry gets a chance to see this. Todd Rule and Todd Rule at the time worked for Coloplast, and if you know anything about this industry, it's a duopoly. It's the only duopoly in surgical devices, and they're both great implants, and they both had great people working for them. But Todd happened to be working with Mentor along with Joel Chechik, and these 13 steps we thought were pretty cool. We actually did one in 6 minutes and 45 seconds, so that's pretty cool to see. So Todd and Joel and I were like, hey, why don't we show people that this can be done? Run Wong came from MD Anderson, and he literally runs in, watches the case, and he goes, now I believe, and he walks out. So it was people within the industry, which you just noted, that were the ones that said, hey, why don't we show people? And now industry is really an integral part of ongoing training, because it's not easy to accrue cases for young residents and fellows to see, and you can only do so much work, with a cadaver. You got to be able to see, and if you can, and depending upon where you are, you got to actually feel. So that was I got to show you our first training program. We made it at Kinko's, and it's hilarious, but it's not much different because it's the same 13 procedure steps.
But what assistance, was it necessary to have Coloplast and Boston Scientific? Was it necessary to have them, be your sponsor? Was your hospital supportive? I mean, how did this get launched?
So you're talking about, who pays for it? Now, if you're in plastic surgery, right, a plastic surgeon will fly to Columbia or from Columbia to here and spend $10,000 to watch a guy do a BBL or a breast implant, and they don't bat an eye. The doctor doesn't bat an eye about spending the money to take for this professor, somebody, whoever's teaching. Here in the U.S., there's only probably 10, 15 programs that are really lit up when it comes to implants. And so there's a lot of residents and fellows that don't have a chance to do it. They don't have the money to be able to fly out and stay in Miami for a couple of nights. So thankfully, both companies are really robust in their educational approach to teaching. And, there's sites all over the country now where we took that model, and both companies have taken that model. And if the companies are willing to fund it, and I'm talking right now to anybody on Grand Rounds, you kids got to go. Yeah, just go. It doesn't matter which implant, which technique. You got to go see and then pick out what's going to be in your armamentarium. So that's why, without that, who's going to fund it for these residents and fellows? You were a tenured professor.
Yeah.
And it's nice to have it paid for, but if that's another discussion. We'll cut it short. But thankfully, both companies are very robust in their educational spending.
Good. Okay. And their commitment to continuing education for urologists and keeping it in our specialty.
Our hands. Yes.
Now, let me ask you this. I know you are working on a penile enhancement technique or procedure or device. Share that with us, and where do you think that is going, and how soon can it get in the hands of our colleagues?
So, you know, when you and I were, 10, 15 years ago working a lot harder than now, um, everything out there for penile enhancement was jaded. Numbers weren't good. You didn't have enough published on it, and the outcomes were pretty horrific. So back in 2000, I think some South Korean plastic surgeons put out some work looking at hyaluronic acid for girth enhancement, and it didn't really catch fire because they're plastic surgeons. You understand? They don't understand the penis, the physiology of the penis, nocturnal tumescence, all these things that if you take everything that we're taught into account, we came up with a now patented in the EU, patented in the US, patented in Mexico, patented in Brazil technique for penile girth enhancement. And I saw you look at me a little funny. Why are you patenting that? I actually patented my technique for the infrapubic. Not so I make my colleagues that learn it and teach it pay me, just so we don't have charlatans, people that pretend to have a fund knowledge or skills that they don't. If I catch them teaching my stuff, then you can go after them. And patents are well upheld in the US and the EU. So I hope that that has kept people out of our implant industry. And I definitely want to keep them out of cosmetics because it's a mess. It's the wild west out there, Neil. And for me, this is a new thing where I'm no longer treating pathology, I'm treating vanity, but it's going to be in our hands. And if I'm going down on the sword with this one. I'm going to make sure it stays in our hands. Board certified urologist with men's health experience, and it's not disseminated, taught by charlatans.
Tell us about the procedure. How many have been done? Can other urologists come and get trained and get access to it?
So we are now going to start uploading in the U.S. because I have all the infrastructure to keep it out of the mongrel's hands, right? And so we're going to be able to teach. I got a couple of universities coming out, and they'll be able to teach their kids, and we will keep it within the realm of our people. It's not like you can't go on and look up the patent, but everything that goes along with it, just like when you and I learned implants and then taught how to do penile implants, it's going to be the same thing. And this AUA, we're going to give whoever wants the opportunity, to be able to be taught in this and to launch this within their practice, within their university, assuming they're board certified urologists with men's health. Usually an implanter. An implanter is perfectly suited for this. You know what I mean? That's all we do. We are stewards of the people.
I feel like I'm a newscaster and you're a politician because you're avoiding answering my question.
Okay,
My
what's the question?
is,
Yeah.
how soon is this going to be made available? What kind of what kind of training do they have to have? And what kind of success rate can they share with their patients?
Yeah. So I've been doing this for 10 years. I actually have published and presented this within the plastic surgery realm since 2014. But I need for you to know, I tried to put abstracts out to the SMS and to the AUA 5, 6 years ago, and they turned it down. I'm not sure why, but now everybody's kind of hot on it. So how do we get trained? People, they can come out at just about any time. We have 6 or 7 going any day. Somebody can get the basics, kind of like we have done with, and we've done this already with Brazil. We already have 62 people taught and doing it in Brazil. And now when people want to come to Miami, it doesn't cost them a dime. They get to come in, watch, and if they're locals, they can help perform these procedures. And then we have what's called a girth boards that goes on every month. So as you're ramping up, you're able to talk about the case because it is a process, Dr. Baum. You can't inject everything at once. And so they will have the opportunity for ongoing education. And this will be launched at the AUA. And if they just call me, my colleagues call me. We have 3 universities coming out within the next 2
Well,
weeks.
like anything else in urology and medicine, there's an art to what we do, and it's
Yeah.
not, cookbook. And so it's going to take some artwork on
Right.
and some investment on the part of our colleagues. Okay, let me kind of wind up and let me ask you, what do you see as the future of prosthetics and men's health going forward 5 years from now, 10 years from now? And we'll stop there because we don't know if we'll be there. Let's go 5 and 10 years
Yeah.
out.
So the things that we always hear about are, well, we're going to have an implant driven by an app. The problem with that is you have to have some sort of power source that will be able to mount 29 pounds per square inch of pressure. And then that power source has to be able to release energy through the form of heat. And how's that going to be transferred through the human body? That's never going to happen because right now, I have hedge fund managers that balk spending 14,000 or whatever the implant company charges for their implant. And are they going to pay 60,000 for something that might work with clap on, clap off? I doubt it. So I don't think that that's the direction. Implants. What we are doing now, the SMS, the AUA, is we are generating now uh, every decade another group of people that are performing good implants. These are not like it is previously, where 75% of implanters did less than 10 a year. Now you have people that are doing 50, 100, and they're routinely doing these cases and putting out really good work. So I don't see that changing from a technology standpoint. Biochemically, things might change when they can take these wonderful growth factors that look so good when you generate it with the shock wave and get rid of the TGFB and have a ligand that puts the right growth factor where it's supposed to be. That will probably be, the future of ED. But, I think our job is to continue, having people that are dedicated implanters. Because if you have dedicated implanters, you're gonna have great outcomes. If you have great outcomes, you won't see this growth that we have seen during our time, Dr. Baum, of 2% a year. It should be 11%, 12% a year. And this year at the AUA, my talk is making penile implants like breast implants. That I see as the next sort of make it that easy, that easy, that simple, and have it so the patients, you don't have these like frank talk and these crank websites because you don't have people having bad outcomes. That's what I see happening over the course of the next 10 years, and I've really seen it over the last 10 years where the quality of work is really going up.
Can you share with us what are your future plans, if any? Same old,
So
same old.
I have twins that are only 5, so people say that I'm going to have to work till I die. But yeah, I don't know. I really want to have the cosmetic end of, and not just because of my patented technique. I want to have cosmetics for the male genitalia be in our lab, and that's going to be my mountain to put a flag on for all of us. And we all deserve it. I mean, we all spend a lot of time, with penises in our hands, and we should be properly, not only compensated, but we should not be the most stressful job in the U.S. What part of the reason it's stressful, Dr. Baum, is by the time they come to you, they spend tens of thousands of dollars. People have not given them anything that's efficacious or possibly safe. So I hope that's my next 10 years.
Well, I think the future of urology is going to be in good hands. You talked about your um, mentors and role models, Dr. Politano and Dr. Carrion
You.
Sr. And my role model was Brantley Scott. And
I wish I could have met him.
and if Brantley Scott had come to Coral Gables and spent time with you and hears all about the things that you are doing in your innovations, he'd be extraordinarily proud of you. Paul, thank you for taking the time to meet with us. It really has been a pleasure. Keep up the good work and keep us all informed. Thank you.
Thank you, Dr. Baum. Always an honor.